Can we see my screen?
Yes, you can.
Okay, thank you very much. And our topic is social mobilization and community development. So I'm going to be talking about, my group is going to be talking about social mobilization and community development, which is a public health approach. Like we know, public health is a course. Public health is a profession that deals with the community. So when you want to develop a community, you have to go to the community and work with the community members. And one thing I would like you to take from this class as a takeaway, if you don't get anything from this class, one thing I would like you to get is that as when you do public development, when you do community engagement development, you have to know that if there is a problem in the community, the solution is in the community. So as public health professionals, we should understand that. So in this presentation, this is the overview. First of all, we'll be talking about social mobilization. Like I said, when you want to solve a problem in a community, you want to do a community development project, you first have to work with the community members. So you have to be able to mobilize them for that to be possible. So we'll talk about the definition of social mobilization, the aim, the importance, the processes of social mobilization, the factors that influence the success of social mobilization, channels by which you can mobilize the community members, and the effects of social mobilization in the community. Then we are going to be talking about community diagnosis. So after mobilizing the community, you want to work with the community members to be able to diagnose the problems that exist in the community. So in talking about this, we're going to give the definition of community diagnosis, the history of community diagnosis, the purpose and objective of community diagnosis, the processes and data collection, because you have to collect data to diagnose problems in the community. And after mobilizing the people and diagnosing the problem, we now want to do some social action for the process of developing the community. So we are going to be talking about social action, its definition, the why, when, and who of social action, planning and implementation of social action, and the types of social action. Then finally, we are going to be talking about community development, because mobilization, diagnosis, and social action will all lead to the development of the community. So we are going to be defining community development, the goals of community development, the principles. We'll give some examples of community development. We'll also talk about how to initiate a community development project. We'll also highlight some challenges of community development before concluding the presentation. So first of all, social mobilization. What is social mobilization? Social mobilization can be defined as a collaborative approach to community development. So like I said, you have to work with the community members when you want to develop a community. So social mobilization can be defined as a collaborative approach that equitably involve all partners. Those partners can be community members and stakeholders in the developmental process, and recognize the unique strengths that each person brings. So when you want to do a community development and you have partners, you have to recognize the strength that each person brings when you're trying to pool resources for the community development. So it is an integrative process whereby stakeholders are stimulated to become active participants in social change using diverse strategies to meet shared goals. We'll be looking at those strategies as we go. So narrowing it down now to public health. We said in relation to public health, it can be defined as a process of participatory action involving health workers, community members, stakeholders, and policy makers. These are the partners I talked about earlier, for the purpose of improving the determinants of health in a community. And like we've seen in the class, we said the determinants of health are a range of factors that influence the health status of a community. So moving forward, talking about the aims of social mobilization now. One of the aims of social mobilization is to adequately inform the vast majority of a community to come forward to demand and use certain health service, to stimulate families to make intelligent and informed choices of demanding and using health services, for example, immunization, to facilitate change from one condition to another, support, clarify, and address society's needs and aspirations, to make the people become actively involved in articulating and responding to their own problems with the support of some health facilitators and experts, and also to enable managers mobilize resources in order that services in order that services meet and satisfy, in order that services meet and satisfy the demand created. For example, dropout rate in immunization. So if the demand for immunization is lower than if the supply for immunization is lower than the demand, we want to mobilize and make sure that the demand is equal to the supply is equal to the demand. That's what that point is talking about. So moving on to the importance of social mobilization. Social mobilization enables members of the society to identify the needs and interests of their society. So when you mobilize, when you go into a community and mobilize the people, they are well able to brainstorm and they are well able to bring out ideas and identify the needs and the interests of their society. It also enables members to promote good leadership and democratic decisions. So every community member is involved in the decision making of the community. It also enables members of the society to identify specific groups for undertaking specific problems. So there may be resources in the community that the people don't know about, but when you mobilize them together, you can now identify that, oh, we have about 50 doctors in this community and we have health problems. Why don't we mobilize this group of doctors to undertake this health challenge? We may have engineers in the community that we don't know, but once you mobilize them and they come together, they can identify themselves and the engineers can take care of like road problems and structural problems in the community. Social mobilization also enables members of the society to be aware of the benefits and the role they can play in disease prevention and control. So when you mobilize them, you can sensitize them about disease prevention and control, and it also helps to explore the ideas and resources they may have to improve disease prevention and control. Social mobilization also creates awareness on proper management of resources for the development of the society. So the society may have resources which is not properly being used, but when we are all mobilized, when the society is mobilized together and the decision making is democratic, they can easily use these resources properly. So next we'll be talking about the processes of social mobilization. So you want to go into a community to effect change and you want to mobilize the community members. How do you do this? First of all, you first have to recognize that there is a problem in the community. When you recognize that there is a problem in the community, let's say there is high infant mortality in this community and you want to solve the problem, you may not really know why that problem exists. So if the problem is in the community, the solution is in the community. So you have to now go into the community to find out why that problem exists. And to go into a community, you first have to gain entry into the community so you can be welcomed. You cannot just go into a community and impose things on them. You first have to go through the step of gaining entry and being welcomed into the community. We'll talk more about that. You also have to be able to organize the people. You have to identify the relevant issues in the community. You also have to assess the strengths, resources of the community, prioritizing and setting goals, arriving at a solution, and selecting intervention partners. So this is more explanation of those points I just read out. So the first point is recognizing an issue in the community. The process of community building begins when an intervention team or community partners recognize the problem that exists in a community and decide to do something about it. So that is the first process. Then you come to the community, you want to do something about it now. Coming into the community, you have to gain entry into the community. Brain White and colleagues, 2001, have stressed the importance of tactfully negotiating entry into a community with the individuals who control both formal and informal, that is the political climate of the community. So if you want to go into a community, you have to recognize that this community have stakeholders, they have leaders, so you have to be able to tactfully negotiate your entry through those people. Then it goes further to say these people are referred to as the gatekeepers. This is just an illustration. Thus, the term indicates that you must pass through the gates. You must pass through this gate to get to the priority population which you want to target. These power brokers know their community, that is, these community leaders and stakeholders in the community. They know their community, they know how it functions. You are just new to this community, you don't really know their values and how the community works. So you have to work with these people because they understand the community, they know how it functions and how to accomplish the tasks within it. Long-time residents are usually able to identify the gatekeepers of their community. So you have to work with these people so that you can get success in gaining entry into the community. So the next thing you want to do after gaining entry into a community now, then you want to organize the people. So obtaining support of community members to deal with the problem is the next step in this process. If the problem is in the community, the solution in the community, and you have to work with the community members. It is best to begin by organizing those who are already interested in seeing that the problem is solved. This can be achieved through organizing workshops, group interviews, setting up discussion platform as a means of creating awareness for the people. So after organizing the people and you get the people on your side now, you now have to work with the community members to identify the relevant issues in the community, because they're in the community and they know how it's hot, they know what they need, they know their problems better, even better than yourself, because they live in the community. So we want to identify the relevant issue in the community. A community development project is only effective when it meets the actual needs of the host community, and this can only be achieved when the community members are involved in identifying the needs of the community. So you have to carry the community members at every stage of the process of community development. So the next is assessing the strengths and resources of the community. It is a process of identifying community assets not concerned with problems. So now you want to know what are available, what are the things available in the community that you can use to solve this problem. What does the community have to bring to the table? This process may involve organizers using a map to identify the different assets in the community, and also identifying the human capacity / resources in the community. So the next step is prioritizing and setting goals. So after identifying the relevant issues, you also want to prioritize, because the resources available may not be able to solve all the problems. So you want to have a scale of preference list where you solve from the most urgent need down to the least. So an analysis of the community assessment data should result in the identification of the problems to be addressed. However, more often than not, the resources needed to solve all identified problems are not always available. Therefore, the problems that have been identified must be prioritized. This prioritization is best achieved through general agreement or consensus. So when you want to do this prioritization, you have to work with the community members. You cannot just decide what is more urgent for them. They have to be the one to tell you what is more urgent for them, because they are trying to work for them, right? So general agreement or consensus of those who have been organized so that ownership can take place. When you do this, work with the community members and they agree on the priority list, they can own the project you are trying to do for them, because they were part of the decision making. So arriving at a solution and selecting intervention strategies. There are alternative solutions for every community problems. The group should examine the alternatives in terms of probable outcome, acceptability to the community, probable long and short-term effect on the community, and the cost of resources to solve the problem. So you want to do a proper strategy. You want to strategize well for every problem you want to bring, for every solution you want to bring to the community, so you don't get stuck halfway. So next we are going to be looking at the factors that influence the success of social mobilization. So you've come into the community and you're trying to mobilize these people. What are the factors that may affect the success of your social mobilization? First, we said knowledge and literacy. If the people are knowledgeable, it is easy to communicate with them and mobilize them. But if most of the people are illiterate, you have to do a lot of explaining, you have to do a lot of convincing, it makes your work harder. But if the people are knowledgeable and literate about whatever you're trying to do, it makes it easy to mobilize them. Next is belief. This can affect the effect of social mobilization either positively or negatively. For example, if you go into a community where you're trying to advocate for example, they should stop the circumcision of ladies, of females. If you go into that community to do that kind of sensitization and the community believes in female circumcision, it will be very hard to mobilize them because of their beliefs. It will not be impossible, but mobilizing them may be hard because of the belief. That's just an example. But also, when you are trying to mobilize the people and work with community members, you must remember to also respect the culture and the beliefs of the people. You do not talk them down. If not, it will lead to ill feelings and they may not be interested in whatever you are trying to do. So even if you are trying to change their beliefs and their values, you should remember to always respect their culture, respect the people in the community. And next is values. The values of a community/society influences the direction to accept health services rendered to them. So if a community is more, let's say you are going into a community to bring health services, but they believe more in traditional healthcare, it may be really hard to gain acceptance in such community. And the next is influence of community stakeholders. So when you're going to a community, you want to work with the stakeholders, because these stakeholders have gained the trust of the people. Stakeholders like faith-based organization leaders like pastors and imam. We see in our community that most times whatever our pastors or the imam tells us, we easily take it. So you want to work with community people that have influence in the community, stakeholders. This will help your social mobilization very easy. As an organizer, you must be able to convince those that have major influence in the community. That is, those the people are more likely to listen to, those the people trust more in the community, to make your work easier. So next we'll be looking at the channels for social mobilization. So this is just how do you get people, how do you mobilize people. The first way to mobilize people is by advocacy. This is the process of informing individuals of their share of the responsibilities in promoting health service. Other ways of mobilizing the people is through the use of mass media, for example television, radio promotion, social media platform, pamphlet, banners, newspapers, etc. Other channels of mobilizing the people are age/gender group meetings. So these are already groups that bring the people together. So you can easily go to those groups and tell them about what you want to do, and easily mobilize them from that group. For example, women group meetings, community meetings, and meetings for children belonging to that society as a means of disseminating information. And finally, another channel is faith-based organization, example churches and mosques. So if you are able to go to a church, churches and mosques have large gatherings, so you can easily go there and tell them about your initiative, and you can easily mobilize the community members through that channel. Facilitators of this should include trained health workers, community health workers, and major influencers of such group, as well as the members of the society belonging to the groups. So if in your social mobilization team, the community stakeholders are part of your mobilization team, once the people see faces they know, faces they have seen before, they are able to easily accept whatever you are doing, because they are seeing familiar faces. So you want to include these stakeholders in your social mobilization team to get a high success rate. So the next we'll be seeing the effect of social mobilization. So first of all, we said social mobilization affect the community in ways that it decrease in disease prevalence. So when you mobilize people, you're able to sensitize them and all that, and you can experience a decrease in disease prevalence. It also increases individual self-esteem. So if you mobilize the people and the people know that they have something to offer also to develop their community, this increases their self-esteem. It also increases acceptance of health services. So when they are part of the solution to the problem, they accept the solution better. It also increases community self-reliance. So social mobilization brings the people together and foster good relationship in the community. It also brings progressive development of the society, and it also increase community resilience. So if you're able to mobilize the people for future times when other problems come, because of how they've been able to synergize to carry out this project, they're able to also mobilize themselves easily in the future. So that's why we say it increases community resilience. So next, we're going to be looking at community diagnosis. So sorry, I just took a bottle of water. Community diagnosis comes after social mobilization. So you've mobilized the people now, and you've identified the problem, you've mobilized the people. You now want to do the diagnosis. What is causing this problem? I would say community diagnosis is the foundation for improving and promoting the health of a community. Community can be defined as a group of people affiliated by geographic proximity, social interest, or similar situations. According to WHO 1994, community diagnosis is a quantitative and qualitative description of the health of citizens and the factors which influence their health. It defines problems, proposes area of improvement, and stimulates action. So community diagnosis helps you to define the problem in the community. It also helps you to propose areas. It helps you to identify areas that need improvement in the community. And once this is identified, it also stimulates action. And we said community diagnosis is a comprehensive assessment of the health status of the community in relation to its social, physical, and biological environment. These are the social determinants of health. So we also looked at a brief history of community diagnosis. Said in terms of the term community diagnosis was originally used in the 1950s by physicians. So we always hear the word diagnosis when you go to hospitals, but it was seen as a revolutionary application of the medical diagnosis of disease to groups instead of individuals. That is, to the community as an entity. So instead of using diagnosis for those individuals, like when you go to the hospital, they now coined it to use it for communities also. So that's where community diagnosis came from. Community diagnosis was introduced in the health planning field in the mid 1960s. WHO published a book in 1982 named Handbook for Community Health Workers in Developing Communities that discussed the concept of community diagnosis. So that's just a brief history of community diagnosis. So what are the purpose and objective of community diagnosis? The purpose of community diagnosis is to define existing problems, determine available resources in the community, and to set priorities for planning, implementation, and evaluating health action by and for the community. So what are the objectives of community diagnosis? The objective includes to find out demographic, socioeconomic, cultural, and educational status of the community, to identify hidden health problems of the community, to determine factors that contribute to health factors, social determinants of health, to identify assets and resources that can be mobilized in the community to solve these problems, to plan, implement, and evaluate micro health projects in the community. So these are just small projects that can help to improve the health of the community. So the processes of community diagnosis. The process of community diagnosis involves 4 stages. You have to first initiate it, you have to do data collection and analysis, you have to now do the diagnosis and disseminate whatever information you have found from the diagnosis. So initiation, in order to initiate a community diagnosis project, a dedicated team or working group should be set up to manage and coordinate the project. The committee should involve relevant parties such as government departments, health professionals, and non-governmental organizations. So under data collection and analysis, the project should collect both quantitative and qualitative data. Also, population census and statistical data such as population size, sex, age structure, medical services, health, public health, social services, education, housing, public security, and transportation, etc., can provide the background of the district. As for the community data, it can be collected by conducting surveys through self-administered questionnaires. So you can just print out questionnaires and share to the community and let them feel it, what they think are the problems in the community, what are the challenges they are facing. You can also do face-to-face interview, you can do focus group interviews, and you can also do telephone interview. And other diagnosis of community is reached from conclusion drawn from data analysis. From this data you have collected, when you analyze it, then you're able to diagnose the problems in the community. It should preferably comprise 3 actions: health status of the community, determinants of health in the community, and potential for health community development. Finally, dissemination of data. The production of community diagnosis report is not an end in itself. Efforts should be put into consideration to ensure that target action are taken. The target audience for the community diagnosis include policymakers, health professionals, and the general public in the community. So you always have to work with the community in community engagement. So the type of data that are collected from this community diagnosis are 2 main type of data: the quantitative and the qualitative data. And the quantitative data does the numeric data, while the qualitative data are descriptive data based on opinions and perception that can illustrate how people think or feel in the community. So what are the sources for data what are the sources, what are the data sources in community diagnosis? So we have two main sources, the primary sources and the secondary sources. And the primary sources are observational, direct communication with respondents, just like the questionnaires and all that we spoke about. You want to go there and get it from them face to face. You can also get secondary data from information that have been stored in files, from tape recording, from past sensors, from the medical data that has been stored in databases. You can get data from offices, from office record of institution, from journals, and from bulletins, etc. So after doing community diagnosis, you have now diagnosed the problem. You now want to take action from what you have found, and that is where social action now comes into place. And we said social action is the practice of taking action, usually as part of an organized group or community, to create positive change in the community. Social action seems to suggest effort directed towards changes in laws or structure or social structure, or towards the initiation of new movements for the modification of current social practice. That was by Peter Lee, 1937. Social action by its nature is often practiced for those who have little power in the society, for the poor, minorities, or people with disabilities. So the why of social engagement. Why do we engage in social action? The following reasons are why people engage in social action. It can lead to long-term positive social change. It may be the only thing that can overcome a major opposition in a community. So if you have a community where the community members have been trying to get development in their community, but there are some strongholds that are limiting the development of that community, like for example in places like Niger Delta, where there is a lot of oil exploration, and these people, because the government make a lot of money for them, and these people, there are cases of oil spillage, their water is bad, their land have been destroyed, and the people are crying out to the government for the government to come and help them, but the government are not listening because the government are making a lot of money from this company. So social action can be one of the method by which we can overcome this opposition, like the NSAS protest we saw last year also, when the youth were complaining to the government and the government seemed not to listen and the youth had to take action. That's an example of social action. It can also unify communities. It creates a spirit of shared effort and shared passion, and binds individuals into a community of shared purpose. Another reason is that it helps to gain particular benefit to the community or part of the community, sometimes on small scales though, and also to institute fairer policies and eliminate discrimination in the community. So when should you engage in social action? When you want to energize and empower the community, you engage in social action, and to develop community leaders. Social action gets people moving. It gets people responsible for their own lives and action, and bring out their leadership potentials. When negotiation and reasons don't produce satisfactory results, you want to go for social mobilization, like the NSAS protest I mentioned. And when you want to catch the attention of the public, the media, and imply public opinion in your favor, when you want to catch the attention of the public, the media, and imply public opinion in your favor about an issue, you go for social actions. So who should engage in social action? Social action is most effective when those who engage in it are those who are interested, whose interests are at stake, because they are more passionate about the social action. Not only should those who engage in social action stand to be affected by it, but they should be the ones who decide that action is necessary to be taken. And they should also, when you're engaging in a social engagement, in a social action, you should also understand the possible consequences of your action. For compromising their cause, there will also be political backlash, there will also be physical danger. So you want to recognize this fact. If you are not ready for all this backlash, do not engage in social action. That is what this point is talking about. So when preparing for social action, what do you need to do? First of all, you need to develop a strategic plan for your social action. You need to decide what kind of action will work best in your community. because different communities you need different strategies for different communities, and what kind of action the community is and is not willing to take part in. So when you mobilize the people, are they willing to take this social action with you, or are they scared? You have to take that into consideration. Prepare contingency plan, so you have to have a plan B when sometimes the effect doesn't work well or doesn't work at all. That is when you need a plan B, so that all your efforts do not just go in vain and the people continue to suffer. Also, you want to choose the time, place, target, and nature of your action based on its purpose and on how it fits into your overall strategy. For example, if you want a bill passed, you should aim at legislators, so be purposeful about your social action. And finally, provide the training and other support necessary to carry out a successful action before you engage in it, e.g. logistics. So you don't want to go to the battle with people that are not ready. So you want to prepare the people when you want to engage in social action. So in planning and implementing a social action, how do you plan and implement it? First of all, you want to get to know the community, very important, because you'll be working with the community. You want to identify the issues that are likely to lead to the community to social action. Identify and contact key individuals and groups. This gives you automatic access to much of the community. So those are the stakeholders and leaders I mentioned early. So you want to recruit community members, work with the community members at every stage, and this can be done by door-to-door campaign, public meetings, conversation in bars and marketplaces. You also want to build a communication system when you're doing the social action, because as you recruit individuals and groups, it is crucial that the people are able to contact one another and that news can be spread quickly and effectively to everyone at every point. So there should be no breach in communication when you're involved in a social action, so no one is put in danger, for example, via emails, phone calls, etc. And also you want to create a structure to help the community accomplish its goals. So once the number of individuals and groups committed to the efforts reaches a good number, so once you've been able to mobilize a lot of people, it is time to pull them together into an organization that will make it possible for them to hash out differences, to plan and implement a unified social action strategy, and this provides coordination and focal points for whatever the community does. Another advantage to this is that it allows the community to speak in one voice. So you want to be united when you are carrying out a social action. So types of social action: persuading the media to cover events or publish stories that highlight particular issues in the community, attending as group a public meeting at which an issue of interest to your community is being discussed. So if they're having a town hall meeting, you want to organize people together to go and make your voices heard, especially those community town hall meetings they have in local government and state and all that. Organizing a group to write letters, make phone calls, or send emails to policymakers in order to make your grievances known. So you want to put your political leaders on their toes. Also, organizing demonstration, rallies, and marches like the EndSARS protest, organizing a strike, organizing a boycott, or organizing a sit-in like the sit-at-home we can see currently happening in the southeastern part of Nigeria. So after doing social mobilization, then you diagnose the problem in the community and you take social action. All this should lead to the community development. So that's how we arrived now to the community developmental part. So community development is the process of working collaboratively and through groups of people affiliated by geographic proximity, social interest, or similar situations to address issues affecting the well-being of those people. So all this action that has been taken should all lead to the development of the community. So that's where community development comes in. It is a powerful vehicle for bringing about environmental and behavioral changes that will improve the health of the community and its members. It often involves partnership and coalition that help mobilize resources and influence system change relationship among partners, and serve as a catalyst for changing policies, programs, and practices. So this was said by the Center for Disease Control Prevention, CDC in US, 1997. So what are the goals of community development? According to the CDC, the goals of community development are to build trust, enlist new resources and allies, so you're able to identify new resources and allies in the community, create better communication in the community, improve the overall health outcome of the community, as successful projects evolve into long-lasting collaborations. So what that is saying is that when you have a successful project, when you go to a community and you're able to carry out a successful community development project, you create a very good relationship with the community, that whenever you want to come into the community, you've already gained trust and you've already built a good relationship with the community members, so you can easily come into the community. You don't need to go through the process of gaining entry and all that. You can easily mobilize the people for future community development in that area. So what are the principles of community development? According to community development is based on concepts of participation, transparency, barrier removal, accountability, local power, and enhanced capacity. The following are the 9 principles of community development. First of all, when you want to go into a community to engage in community developmental projects, first of all, you have to be clear about the purposes, the goals of the engagement efforts, and the population and or communities you want to engage in. So if you look at the definition of community we gave the other time, we said the community can be a geographic location, those with special interests or those with similar situations. So you want to define the community. Are you going for a geographic location like Ogun State, or are you going for people with special interests like people that have cancer, or people that have similar situations like people of disability or people of race and all that? So you want to define the purpose and the goals of your engagement and the population you are targeting. That's the number one thing. So number 2, you have to become knowledgeable about that community you have targeted. You have to be knowledgeable about their culture, the economic condition of the community, the social network, the political and power structure in the community, the norms and values of the community, because you have to respect the norms and value of every community you are trying to develop, you are trying to gain access to. You also have to understand and gain knowledge about their demographic trends, the history, and experiences with efforts by outside groups to engage in various programs. What that is saying is that when you've identified the community, you want to gain knowledge about them and the experiences they've had with other people that have tried to carry out developmental programs with them, because some people in the past might have come and they might have they might have done some things that the community members now have ill feelings towards them. The community members may not trust them. So if you are coming to that community again to do something like that, the community members may not trust you. So you want to do your background checks. Is there an history of bad omen or bad record in this community by those who have tried to do developmental programs? Like the people do not really trust the government. So whenever a government is trying to do a program, the people do not really welcome it well because of the ill feeling they have towards government. So if you are engaged in a governmental project like that, you have to do your background check, and when you are going to the community, you have to explain to them that I know what happened in the past, blah blah blah, but we are trying to fix that and we are not like those people. So that's what that point is talking about. You also have to learn about the community perception of those initiating the engagement activity. Yeah, it's still saying the same thing. You have to learn the perception. You have to know how the community perceives you for the success of your project. So the third principle is that you have to go into the community, establish relationship, build trust, work with the formal and informal leaders, like we mentioned earlier, faith-based organization, the OBAs and all that, and seek commitment from community organization and leaders to create processes for mobilizing the community. And number 4, you have to remember and accept the collective self-determination. You have to remember and accept that collective self-determination is the responsibility and right of all the people in the community. No external entity should assume it can bestow on the community the power to act in its own self-interest. So when you come into a community, you cannot just bamboozle them and put things on them. You have to be ready to work with the community members, give some control to them, and allow it to be a democratic thing. Work, like I always said, work with the community, carry them along at every step. Then number 5, Partnering with community is necessary to create change and improve health. So this is the fifth principle of community development. The sixth principle is that all aspects of community engagement must recognize and respect the diversity of the community. When I was doing some research about it, these sixth principles, the diversity of community, part of the things I saw were working, like if you're trying to work in the US, you have to know that there are diverse gender groups, the LGBT and all that. But when you're working with them, you have to respect them. You have to respect their diversity. You may not agree with them, but you have to respect them. That is part of the principle of community development. Awareness of the various culture of a community and other factors affecting diversity must be paramount in planning. In planning, designing, and implementing approach to community, implementing an approach to engaging a community. And number 7, community development can only be sustained by identifying and mobilizing community assets and strengths, and by developing the community's capacity and resources to make decisions and take action. So you cannot do it on your own. It is more successful when you work with the community members. And number 8, organizations that wish to engage a community as well as individuals seeking to effect change must be prepared to release control of actions or interventions to the community and to be flexible enough to meet its changing needs. So you have to, like I've always said, work with the community members, carry them along every stage. They are your partners in the developmental process. And finally, number 9, community collaboration requires long-term commitment by the engaging organization and its partners. So when you go to a community, you don't just do what you want to do and leave. You also you want to have a long-term strategy so that whatever solution you have brought to the community don't go back to the problem that you have tried to solve with them. So it is important that community development do not operate in isolation. They must work collaboratively with stakeholders from a variety of other sectors as well as community members. So you want to work with the private sector, the public sector, the community members, the faith-based leaders, and the urbans, the traditional leaders, and all that. So examples of community development. Some development program can be directed to assist specific segments of the population to satisfy their social needs. The assistance include the following type of community development projects. So community development projects can be health promotion and sensitization, decrease in unemployment rate, homelessness prevention project, neighborhood sterilization project, domestic violence project. So these are just examples. Number 1, health promotion and sensitization. Such projects do promote preventive health so that you can reduce the burden on the community health care center. It also, such health promotion and sensitization helps to promote healthy lifestyle like exercising and dieting for better health in the community. It also helps to this kind of programs, health promotion and sensitization, help to advocate against the use of hard drugs, also sensitize and also sensitization and health education to promote personal hygiene. For example, the use of pads by young females. Another example of a community development program may be decrease in unemployment projects. This will help to increase the socioeconomic aspect of the community. This assistance can be realized through building job training centers for the unemployed and helping adults in the community find employment. To achieve this goal, local companies can cooperate with community organizers to hire displaced workers. The program provides job-related training, job search assistance, and other programs improving skill acquisition. Another example is homelessness prevention project. Community programs aimed at preventing homelessness in the community can involve upgrading facilities for homeless people, economic empowerment for low-income families, helping no-income families in gaining access to public funding, and receiving help from the government. Another example is neighborhood sterilization project. The neighborhood sterilization program are dealing with foreclosures and home abandonment. The local government can purchase foreclosed and abandoned homes in the community. The thing is, abandoned homes often become centers for various crimes in the community. So neighborhood sterilization programs may demolish an abandoned home or redevelop it for more productive use. It helps in improving the overall economic outlook of the community also. And another example is domestic violence community development projects. Such projects provide relief to the victim of abuse. The program creates and upgrade the programs create and upgrade facilities for domestic violence victims or offer safe places for survivors of domestic violence and their children. These programs are also aimed at the psychological support and encouraging survivors of domestic violence. The victim may also be provided with legal help and advice on the possible method of acting against the abusers, like suing them to court and all that. So, how to initiate a community development project? The process of implementing a community project should involve diagnosing the relevant issues with the community members you want to diagnose, know which issues are relevant to the communities. You have to determine the project goals and objectives. You should have long-term goals and short-term goals. You should not just do and go. The project, whatever you're doing, should be able to help the community over a long time and should be maintained. You also want to create a project design and plan and strategy so that that project can be completed. And you also want to do a feasibility study and budget for the project, so you don't start and on the way the money gets finished and the project is abandoned. You also want to seek for sponsorship and grants, because most community projects cannot be done out of pocket. So you want to seek grants, companies that do give grant and sponsorship, or public, the federal government or the state government or local government. You also want to identify and collect the necessary resources for implementation. So the community may also have something to bring to the table for the development of their community, and you want to also create appropriate timeline for the implementation of your project. This is important because some grant awarding companies some grant awarding organization may give you a grant with a timeline. So if your project exceeds that timeline, they may not be willing to continue to fund your project. So you want to create appropriate timing for the implementation of whatever community development project you're trying to do. And also, in some form of community development project, you have to do a pilot test. For example, you want to share questionnaires. It is important to do pilot tests to know if the intervention you are trying to bring to the community will work. So if you do your pilot test and you see that it's working perfectly, you can go ahead. But if you notice some if you notice some things that do not work in the program, you want to change it, tweak it, so that it will work perfectly for the community. That's the importance of pilot testing before you now go fully into implementation. So implementation and dissemination of results. Then you want to do follow-up, monitoring and evaluation of whatever community development program or project you have done. You have to monitor it so it doesn't deteriorate over time. So here are challenges of community development. I have 5 minutes, so I'll just run through them. So the challenges of community development involve non-involvement of community members in the decision-making process of the project initiation and implementation process. Poor planning is another challenge to community development. Sorry, I will not be able to explain this because of time. Vandalization and abandonment of projects is also another challenge. This occurs when community do not understand the project as a result of non-inclusion in the decision process of initiation and implementation of the process of the project and program. So when they don't understand it, they may just not use it, they may even go and destroy it and all that. Literacy is also a problem. Poor implementation, when a project is not properly implemented, it deteriorates over time. Economic factors, when you're not able to get a lot of money to do a development program. Corruption and embezzlement, we see this a lot in our country. When they release funds for, let's say, to do a road, they use 10% they eat 90% of the money and do 10% and use 10% to do the job. So you can imagine how the job will turn out to be when only 10% of the release fund is used. Maintenance is also a problem in our country, and in a problem with community development projects. If it's not maintained over time, it deteriorates and the community goes back to the problem. Political considerations, when you want to do a community development project and an OBA is saying let's bring this to my own local government, somebody else is saying no, let's bring it to our own local government. All those kind of things are challenges to community development project. Poor supervision, when a project is given to a contractor and is not supervised, the contractor can just do whatever he likes and go, and the development may not even work, may not be helpful to the community. armed conflict is also a problem of community development. Any society that is in conflict, there can hardly be any development in that society. So finally, what makes a successful community development project? Community development is used as a technique by agencies, NGOs, etc., as an approach to reach community for the implementation of their project agendas and programs for the well-being, progress, and development of communities. A community development intervention is said to be successful when it effectively solves the problem it is intended to solve for the community in the immediate and on long-term basis. So in conclusion, why is community development important? Community development is important because it provides the foundation community development is important because it provides the foundation a city built off of to improve the lives of its citizens. It creates strong, diverse communities that are able to attract and keep talent, start and grow businesses, and overcome issues that arise. Citizens will be happier when their communities develop. They will be healthier, richer, and live longer lives. Businesses will have a larger base of customers who can purchase their products and services, and cities will earn more tax income to continue to support important programs and reduce the debt of the community. When community development is effective, there is less crime in the community, less disparity between citizens, the rich and the poor, better jobs available, a more talented workforce, and less overall issues that impact the residents of the community. Community development does not necessarily solve the whole problems in a community, but it reduces the problem and increase opportunity for growth. Without community development, both health and the economy of the community will suffer greatly. Thank you very much.